Good morning, everyone. My name is Dr. Jody Guest. I am an infectious disease epidemiologist, professor and vice chair of the Department of Epidemiology at Rollins School of Public Health here at Emory University. I lead Emory's COVID-19 outbreak response team working in hard-hit communities across the state of Georgia, and I'm very pleased to be the host of Emory's COVID-19 Facebook Live event, where we talk about the latest data on COVID-19 pandemic. Today, I'm pleased to be joined by Dr. Andi Shane and Dr. Evan Anderson. Dr. Shane is the chief of the Division of Pediatric Infectious Diseases at Emory University School of Medicine and the medical director of infectious diseases at Children's Healthcare of Atlanta. Dr. Anderson is a professor of medicine and pediatrics at Emory University School of Medicine and a pediatric infectious disease specialist at Children's Healthcare of Atlanta. Good morning to both of you, and thank you so much for joining me today.
Good morning.
Today, we're going to be talking about the exciting news from Pfizer about vaccines in younger children. The FDA approved the first COVID-19 vaccine for emergency use in children 12 to 15 yesterday. Pfizer was already the only vaccine approved for children 16 and 17 years. This is a huge milestone in the pandemic, and it's time to have a big impact on the next school year, which we'll certainly be talking about today. The news comes as the US continues to see declining rates of COVID-19 across most of the country, and with 45% of the US population having received at least one dose of COVID-19 vaccine and 33% being fully vaccinated. Declining rates are certainly a result of the number of people who've been vaccinated so far, and so to be able to bring vaccines to younger children becomes incredibly important as we fight this pandemic. More than 3.8 million children have tested positive for COVID-19 in the US since the start of the pandemic. While fewer children than adults have suffered the most severe disease, this is not a benign disease in children. Thousands of children have been hospitalized and hundreds have died, making the vaccine in this age group really incredibly exciting and important. Today, we're going to dive into the news about expanding vaccines to those under 16 years and looking at some of the data. The data came from a trial of 2,300 adolescents between the ages of 12 and 15, half of whom received the same Pfizer dosing as the adults, and half of whom received the placebo. Researchers took blood and measured antibody levels and found that a stronger immune response in teens than those even found in young adults. There were 16 cases of COVID-19 in the trial. All of them were among those who received the placebo, suggesting that the regimen actually offers the same or perhaps even better protection than that which we see in adults. So Dr. Shane, let's turn to you first. The FDA handled the Pfizer 12 to 15-year-old trial as an amendment to their existing emergency use authorization as opposed to a new EUA. And the advisory committee for the CDC will be looking at it on Wednesday as well. When do you expect to see the first vaccines happen for children aged 12 to 15 in the United States?
So that's a great question, Jody. And I think that, hopefully Thursday morning, the vaccines will start, maybe even earlier than that. But at least in the United States, we usually wait for recommendations from the CDC, ACIP, Advisory Committee on Immunization Practices, before vaccines are deployed. One of the advantages is that with electronic registration and appointment setting, appointments can be made ahead of time, and many places are starting to do that now. But really the deployment will hopefully begin on Thursday morning.
Wonderful. That's so exciting. Dr. Anderson, turning to you, the study was designed to test whether it triggered immune responses in children and not whether it actually prevented disease. But because of the number of children who became ill in the placebo arm, the data actually seems to suggest the vaccine offered robust protection for kids from COVID-19. Does this suggest that there's actually more COVID-19 disease in children than we might think?
Yeah, that's a great question. So as you mentioned, it was not designed to be able to demonstrate an impact upon actual infection or disease, but yet they were able to demonstrate that it had very good protection against infection. And this does kind of correlate with what we're seeing in the US, where over 20% of all new cases of COVID-19 are occurring in children at this point in time.
Wonderful, thank you. So there was a wonderful statement that came out this morning from Dr. Lee, the president of the American Academy of Pediatrics, and that said the youngest generations have shouldered heavy burdens over the past year. This is a quote. And the vaccine is a hopeful sign that they will be able to begin to experience all the activities that are so important for their health and development. So Dr. Shane, let's talk about what this trial means and the data means for the fall 2021 school year across the United States.
So I think that's a great question, and also just a fantastic quote from Dr. Lee. And, while the clinical burden of disease of SARS-CoV-2 and COVID-19 has been substantially and thankfully less than in adults and older adults, the unmeasured impact of this virus on development, on socialization, and behavior in children is really very tremendous, and something that I think we're just beginning to get a grasp on understanding. So having children vaccinated will really help us bring children back to school. It's one of the other mitigation methods that we can use along with masking, hand hygiene, and physical distancing, and really gives an additional assurance that a child is protected wherever they go and whatever they do, and really will be essential for getting back to school in the fall.
Do you think it also has an impact on camps this summer if we get kids vaccinated fast enough?
Absolutely, yes. And so hopefully most of the camp counselors have already been vaccinated, and now we'll start to work on the campers themselves.
Wonderful.
Absolutely agree. I'll even interject. My two oldest kids will be getting their vaccine dose, hopefully both doses of vaccine in before they go to camp this summer. So it really brings a tremendous amount of hope for those parents out there that have had a fairly long 14 months of homeschool and virtual school and hybrid school situations.
Yes, it's been a long 14 months for sure. Dr. Anderson, there's been a lot of conversation about how well kids actually transmit COVID-19 and if schools should be open, shouldn't be open right now. So what do we know about the role of children in the transmission of COVID-19?
So it's clear that kids can carry as much virus as adults do in their noses when they are infected with COVID-19. The older children seem to be perhaps a little bit better at transmitting virus than the younger children are, and yet it is a relative difference. And the important thing to note is that even the younger children can and do transmit SARS-CoV-2. And so ultimately ensuring that all kids can receive vaccine is actually going to be critically important to ultimately achieving the quote unquote herd immunity that everyone's talking about.
Absolutely. We can't get to any level of vaccine-oriented herd immunity if we don't count our children in these numbers. Out of more than 581,000 COVID-19 deaths in the United States, about 300 of those have been under the age of 18. This is for sure a tiny fraction, although any life lost is certainly not what we want to see. However, this number does actually exceed the number of children who die in a bad flu season. To put it into some perspective, children also rarely suffer quite the level of severe outcomes from COVID-19 that we've seen in a lot of adults. But Dr. Shane, let's talk about what are some of the possible long-term consequences of infection in children, even from mild or asymptomatic courses of illness among kids.
So that's a great question, Jody. And I think that what we do know is that there's a post-inflammatory syndrome known as MISC, or multi-system inflammatory syndrome, in children that we have seen in over 1,000 children in the United States. And really happens 3 to 4 weeks after a COVID infection, sometimes one that is not actually recognized. And so we are understanding many of these children have required hospitalization and have required care at varying levels in the hospital. The good news does appear to be that the long-term manifestations are not significant. However, we still are following very closely with cardiology colleagues and others to really understand the effects on the cardiovascular system. So that's one long-term manifestation. The other is we're also starting to see long COVID, or it's also known as PASC, which is symptoms of fatigue, sometimes respiratory challenges, and muscle pain, and just not being able to be themselves, similar to a chronic fatigue syndrome in a number of children, especially adolescents who have had COVID-19. So we're getting a better grasp on that now as more children have been infected, and we've been able to monitor them very closely. But those are the two, the MISC and the PASC, that we're starting to see in children are two of the long-term manifestations. From a clinical perspective, then, of course, the developmental and behavioral of not being in an environment, not being able to socialize, which will take us generations really to understand.
Thank you for making sure that we talk about that as well. This question is for both of you. Do either of you have any safety concerns about these vaccines for 12 to 15-year-olds?
No.
No, I don't. And I think what is also important is that those that are 16 and 17 years of age, the vaccine's been rolling out for them for the past really months now. And indirect data from CDC suggests that probably over several million doses of vaccine have been administered to the 16 and 17-year-olds nationwide. So there's ongoing surveillance for vaccine safety through multiple systems through CDC. And so far, all data looks reassuring.
Great, thank you for that. And I have one of the 16 and 17-year-olds who received the Pfizer vaccine in my house. And she received it with nothing other than a sore arm, and is now a month out. Moderna is also studying their vaccine in children and teens, and we've seen some minimal data from Moderna's Teen Cove study looking at children aged 12 to 17, which began in December of 2020 and is fully enrolled. Last week, they showed us some exciting data from the trial showing 96% efficacy against COVID-19 and no other safety concerns. Dr. Anderson, you're one of the principal investigators at Children's Healthcare of Atlanta and Emory University for the clinical trials in younger children, especially those that are going to be looking at kids 6 months to 12 years. Is this the same Moderna mRNA vaccine that's being distributed nationwide for adults?
Yeah, so the 12 to 17-year-olds study was not conducted at our site, just to clarify, but I will be conducting the Moderna Kid Cove study, which will be those 6 to less than 12 years of age. It is exactly the same vaccine. Currently, the study is evaluating the best dose to be given to various age ranges. What will happen is that there'll be more widespread enrollment of much larger numbers once that the best dose is identified, in order to then look at safety and potentially even how well the vaccine works in prevention of COVID-19 in those children.
Excellent, thank you. Let's talk about your message to parents if they are reluctant to get their 12 to 15-year-old vaccinated. What would you say to them is the most compelling reason, or some of the multiple reasons that you would ask that they consider getting their children vaccinated?
So I think one of the most compelling reasons really is that in addition to protecting the child or the child protecting themselves, there is a lot more accumulating evidence that there will be protection of other people who the child may interact with. I'll also say that, having a conversation with adolescents about vaccine hesitancy, oftentimes we do address our conversations and discussions to parents, but this is really an important opportunity to make sure that we include the child in the conversation as well, and understand what some of their challenges or fears might be, and how they're talking about it with their colleagues and their friends, and then also addressing some of the parental concerns. Oftentimes these vaccine hesitancy conversations take place over a period of time. It's not a single conversation. So even though the vaccine is not actually available right now, this would be a wonderful opportunity for parents and clinicians and people in other roles who interact with adolescents to really talk to them about the importance of getting a vaccine. And then finally, I'll just say role modeling. Adults are able to get vaccines. And so presenting to an adolescent that you yourself have received a vaccine and have done well is probably some of the most important evidence.
Thank you, Dr. Shane. How about you, Dr. Anderson?
Yeah, so I think a number of children, including mine, actually are fairly afraid of COVID-19 and have lived the past 14 months in a fair amount of fear about the future, about the health of their family, and about their own health. And so being able to communicate that here's a chance for you to do something to help keep yourself safe is an important message that may resonate with some children. The other important thing is that many of these older kids remember well what life was like in 2019 when things were quote unquote normal. And they would like to get back to that. They would like to get back to their extracurricular activities. They would like to get back to their school activities. And so I think that can be tremendous motivation for children in the teenage years.
Where would people go to get these vaccines when they become available? And will schools be a good place to administer them? Or do we turn to CHOA? Do we turn to pediatricians, pharmacies? Where should we go?
So I think one of the great things, Jody, is that there's lots of opportunities in the community. And so obviously pediatricians' offices will be offering them, and that's one opportunity. There also will be mass vaccination sites that will continue to offer vaccines to adults and also to children of the 12 to 15-year-old age group. And then there have been a lot of discussions about community-based vaccination clinics in the Atlanta metropolitan area, and especially once schools are out of session towards the end of the month, that may provide an opportunity to offer vaccines in a school setting where children are familiar with the local environment and the local neighborhood. So we really encourage parents to look and find the area or the closest place and go from there.
Thank you. Let's get back to some of the side effects of COVID-19. You were speaking about them earlier, Dr. Shane. What about neurologic effects of COVID-19 in children?
So that's a great question, and we have taken care of some children here at Children's Healthcare of Atlanta who have had some neurologic manifestations that have been associated in time with having a COVID-19 infection. There have been reports of some children, one or two, who have had a stroke-like event, and we also have to look at what people's underlying medical conditions are as well, because that can predispose them to neurologic conditions. Some of our children who have been quite ill with MIS-C have had delirium and have had situations where they haven't been oriented and have had some required some rehabilitation after their recovery, which has also required some reorientation. And these children are also being monitored very closely by psychologists to make sure that they get back to where they were before they had the condition. So it's a very interesting virus. We don't know why it affects children differentially. Some have basically a mild runny nose, some never know, and some require long periods of hospitalization, and unfortunately, some die. So I think that's also another important evidence to get vaccinated, because you just can't predict what your child will experience or what a child will experience if they do have an infection.
That was actually going to be my next question. Is there any way to predict which children are going to have some of the longer term side effects from COVID-19? I'm guessing the answer is no, based on what you just said.
Well, at least prediction, perhaps not, but understanding some of the more common attributes that we do see in children who have more severe infections, and that's been looked at very closely by different academic centers here at Emory and Children's, also at CDC, who's collecting data on the national level to try to understand if there are common factors that may predispose a child to having a more severe infection or even a post-infectious phenomenon. But we're in the data gathering stage at this point, and there are some key attributes that seem to be coming out, but still lots more to be done.
Do we see some of the same side effect, some of the increased risk in some of the underlying comorbid conditions that we see with adults, obesity, diabetes, other lung conditions?
Yeah, that does appear to be the case. Obviously, those underlying conditions are less frequent in children, but they do seem to carry increased risk.
Okay, and we always want to make sure that we alleviate any concern about allergies in these vaccines. If a child has a severe peanut allergy, can they take this vaccination?
Yes, so they can receive this vaccination. The only clear contraindications would be allergy to polyethylene glycol, sorbitol, or to mRNA vaccines in the past.
Which they're unlikely to have seen.
Right.
Yeah.
They would not have seen.
Right. So moving back to the younger children trials and the data, it's so exciting to be talking about vaccines in 12 to 15-year-olds, but we certainly also want to be remembering those who are under 12 and all the work that's going to be done to hopefully safely give vaccines to them as well. What still needs to happen in the trials for the youngest children, and what do you suppose that timeline might look like for some younger age groups to even see these vaccines?
Right, so both Pfizer and Moderna have ongoing studies in those 6 months to 11 years of age. Importantly, similar to the phase 1 adult studies, the first step is to identify the best dose for kids. And that's the stage that both vaccines appear to be in currently. Pfizer has said that they anticipate having data on those 2 to 11 years of age by September, is what they had said publicly recently. Moderna has not said anything to the best of my knowledge. And obviously that timeline is, it could end up needing to be more flexible than that, but that's what we know to date.
Okay, so continued good news, hopefully coming forward. With safety, of course, being the #1 concern when we talk about any vaccine, but particularly as we talk about our young kids, wanting to make sure that we know that these are safe in these children. When we talk about safety and efficacy of these vaccines, I know in adults, you had a tiny bit of wiggle room on your timing of these vaccines. Pfizer suggested, and CDC states that if you have to get it early, 4 days is kind of the earliest they want to see you move that second dose up, but you do have a fairly long time period to get that second dose. Is there any reason to believe that that's different in these 12 to 15-year-olds, or that it changes the efficacy of the vaccine at all?
Really, there's nothing to suggest that there should be any impact upon the efficacy of the vaccine. Part of the windows and the reason that these are licensed the way they are is because that's the window that was used in the clinical trials where there's the most data. But there's nothing to suggest that delaying vaccination should impact the net immune response or the safety of the vaccine. Shortening up the timeline may cause some issues as far as not seeing as robust of an immune response based off of data we know from other vaccines where we've tried to shorten up the interval between the first and the second dose.
Okay, and for kids who've already had COVID-19, how important is it that they get this vaccine?
It's very important, Jody. We don't know how long immunity from natural infection lasts, especially in children. And the vaccine really is the optimal way of providing protection, and is an important mitigation measure along with everything else that we've been doing.
That is one of the things that I've heard pretty consistently. I've already had COVID-19, so I can wait to get the vaccine. And certainly we're trying to undo that idea in the adults. So need to continue to do that in children as well. The FDA, as I said earlier, handled the EUA for 12 to 15-year-olds as an amendment to their already existing emergency use authorization for adults. Do we expect that the FDA will handle the same sort of EUA for the younger kids, or do we expect that it might be a new emergency use authorization? Either one of you?
I mean, I'll start and Evan can continue. I mean, I think we don't know. We just can't predict what's going to happen. Perhaps if there's different dosing for different age groups, it might be handled in a different way other than an amendment. But just time waits for us to know the answer to that.
Okay. And given the rapid expansion of variants, how important is it that we vaccinate our children as soon as we have data to support that it's safe?
Yeah, that's a great question. So there have, so to take a step back, the virus that causes COVID-19 is SARS-CoV-2. It's an RNA virus, and it does what RNA viruses do well, which is to acquire mutations over the course of time. And so we've seen emergence of a few different variants over the course of time, and we anticipate that we'll see additional variants develop as well in the future. But as such, there have been pretty extensive studies looking at how well the blood from those that have received prior vaccine matches up against the variants. And in general, the match has actually been quite good, including against the original UK strain. There's perhaps a little less degree of activity against the original South African variant, which is the B1351 strain. I think the news there, though, is that the limited efficacy studies that have been published to date still demonstrate that, that the vaccines appear to be effective against that B1351 strain. And there are ongoing studies by several of the major manufacturers of a variant vaccine in case it should be needed in the future.
Thank you. All right, as we wrap up, I'd love your last thoughts about the use of the COVID-19 vaccine in teens aged 12 to 15. What are your last thoughts, Dr. Shane?
So I think this is just fantastic and a wonderful opportunity to really continue getting us back to the way we were. And this is a very, very, very important tool in the mitigation methods that we have already been doing and using as we go forward. I also just wanted to add one other point about trying to get vaccinated as soon as it's available because of other vaccines that children may need to get, especially adolescents, and a period of time between the COVID-19 vaccine and other vaccines. It's really important to try to get the COVID vaccine now as soon as possible so that when the fall starts and we start thinking about back to school immunizations, we don't have to worry about those time periods past receiving a COVID-19 vaccine. We really want to keep everybody up to date on all their immunizations.
Dr. Anderson, your last thoughts about this?
Yeah, so having two children in the 12 to 15 range, both of mine were already signed up to receive vaccine on Wednesday. It looks like, depending on timing of the ACIP meeting, it may be delayed just a little bit, but it can't be soon enough from my standpoint to see the vaccine move forward in the 12 to 15-year-olds. And then we're looking forward to having data to support, hopefully being able to advance vaccine down for our younger children as well in the near future.
I think that says so much when you have already signed your children up for their vaccine. My daughter was signed up the very first day a 16 and 17-year-old could get it in the state of Georgia. It was already approved, but just not, they weren't the age group that was eligible. So I think it's safe to say that all of us are extremely excited about the data that has come out and the safety of these vaccines in children, as well as the urgency of getting this age group vaccinated. Dr. Anderson and Dr. Shane, thank you so much for joining me today. We appreciate all the questions we got, and I very much look forward to us moving forward with new data on our even younger kids next. Thank you, everyone. Please stay safe and have a great day.
Thank you.
Thanks.